All right. I am closing us out for today. My name is Hannah Anderson. I'm the Associate Program Director of the University of Utah Graduate Program in Genetic Counseling. And I have been working for a couple of years now on an Academy of Health Science Educators funded project, so thank you, with my director Karin Dent on incorporating simulated patient rotations into the genetic counseling program. So a little bit of background on genetic counselors. Our job is to educate patients on genetics information, but also help with the emotional, personal, and familial adjustment to that genetic information. And our accrediting body has a lot of rules also, and some of those include 50 cases that come from very specific settings, and one of those is prenatal. And a few years ago, we were finding that prenatal genetic counseling training spots were kind of a bottleneck for us and causing us to have more worries about getting our students through the correct number of cases and through good training slots locally. So we decided to innovate by creating a simulated patient rotation with 12 cases that address core prenatal genetic counseling scenarios. And so my scenarios are here. I won't read them to you, but I will say that these were developed by me. I have prenatal counseling experience myself, and a couple other prenatal counselors came up with what we think is, and of course this is open to interpretation, an increasing difficulty, broad skill set of genetic counselor prenatal caseloads. So we could certainly have a conversation about which ones are harder than which, but the goal was to start off with some core topics and then advance to some more high acuity, high risk pregnancies, more emotional conversations. And so we used we've been using an iterative process of script writing for these based on the Association for Simulated Patient Standards of Best Practice to develop cases that not only incorporate the medical information, but also the personal information that our patients bring to clinic. So I know that I myself and many of our script writers are thinking of patients with specific emotional, complex family needs who have come to us for these genetic counseling appointments, and we are putting our students in these situations that are drawn from real life experiences. So now we are starting this week our third round of this 6-week clinical rotation. And for our first 2 rounds, I was able to collect student satisfaction data on their experience. We haven't really looked at educational outcomes, but mostly just their experience and whether or not they felt like they were learning from these encounters, and they felt good about it overall. There were a couple of places where I think we have room to improve, one of which is our lowest scores for this standardized survey was they were not finding their ability to work as a team being as strong in this setting, and that makes sense because many of our clinical roles involve multiple people, and we've not been bringing multiple people into the simulation besides for the genetic counselor, the supervisor, and the patient. We, just from this this meeting today, we're thinking about maybe bringing in someone with an interpreter and how exciting that would be to incorporate into this clinic. And then a couple of the students found that we have 3 of these that have been virtual, so held over Zoom, and those have felt less real to the students. Some of that was me fumbling around with Zoom in our first round of this, which is why this is an iterative process. So I think those have improved with my ability to manage breakout rooms, but hopefully they will continue to improve. So I have some really great quotes from my students. I won't read them all to you, but they have shared some really lovely experiences with this. One of our students talked about how when they were studying for boards, they felt like, man, they really knew the prenatal concepts. Many of their peers who had been through a traditional prenatal rotation saw the same indication over and over again, and that was a really valuable experience, but maybe they didn't touch on every aspect of prenatal counseling that might be tested on an exam. And so our students who went through this had a broader level of experience. And then another student said how this environment made them feel more safe in trying advanced psychosocial interventions. I know as a supervisor and as a student a long time ago that sometimes when you're with a real patient going through a real life situation that is difficult and hard and weighty, a supervisor jumps in and takes over as a protection for that patient, where in this setting, no one did that. The students were allowed to try things, to try new techniques, to fail a little bit more safely with these harder techniques, and the supervisors were a lot more willing to let them try and see their success come out. So there's a lot of confidence building that was able to come from this as well. So we've seen all of our students who have been through this have passed their exams. I have no evidence of how they've done relative to their peers, but everyone's done very well. I think the more we do this, the more we'll learn about the true benefits. Right now, I think we can certainly say there's no statistical evidence of this detracting from anybody's education. So, thank you. Any questions?
So, how did you select your patients? Sorry, I took your applause.
Oh, that's okay. You can clap for me later.
Yeah.
Some of this was based on my experience.
Simulation patients.
Oh, the simulation patients. So we've used the simulation center upstairs and the one at the College of Nursing. So those have been employed as trained actors through those two locations to support students in a variety of different medical education settings. And so we utilize those resources.
She is a standardized patient. She was here before.
Who is her?
Susan?
Yes.
She hasn't done these ones.
She's been on different ones.
Yeah. So
I know somebody.
everybody's itching to go home, but I still have another question. I know I was hated as a student by my fellow students. No, come, just shut it down, just be quiet. But in anesthesia, we have what's called an objective structured clinical exams, where behavior with regards to colleagues and patients is actually part of the board exam. And so they get scores. And so we know from our graduates which particular element they failed or passed. And I was wondering, are there objective clinical exams of these counseling sessions for your profession?
I wish there were, but there are not at this time. Our certification is a multiple choice, single correct answer exam. I think there's a lot of talk in using simulated patients just sort of like as a genetic counselor education community. That is something that's been talked about a lot, but there's no changes at this point, so.
Did you think about examining or testing how the intervention improved performance in a simulated exam?
At this point, all we've really looked at is the student self-reported experience. I do think about that, yes, but that is not something that we have done at this point.
So I've got one quick question too. So I think that what you're asking is great, and in the simulation centers, and Anne is the director of the College of Nursing Sim Center, and the director of CISPL, which is our Center for Interprofessional Simulation-Based Experiential Learning, and I'm right now serving as the co-director, but that's not my question. So we do lots of OSCE type things. So there are things that, but what I love about what you're doing is it's very different, and it's a developmental simulation, and it's replacing patient care. And the conundrum that we all have of finding adequate clinical placement sites. And so I think this is absolutely incredible that the students actually might learn better with this than they do in the actual clinical setting.
Yeah.
They feel safer. So I just want to say, wow, kudos, and from the mother of one of your SPs who did this, which was awesome. Which you guys saw her dancing earlier. Hannah was one of the SPs last year. I just think it's really great and a really novel way for us to think, how can we expand the way that we train? So,
yes, and I will be done in just a second. I do think it is important to note that I do think summative assessment with simulated education is great, but I do think the formative assessment and not having this specific grade, but coming in with a debrief and just feedback and conversation around what happened is a good way to build those skills as well, and is what happens in our clinical rotations that we're trying to build in the simulated way. So yes, exactly.
Can I add one last little thing on that? One thing that's also advantageous about all this is we can tailor remediation to these sorts of scenarios. So we know they're doing okay in the basics, but when they're more psychosocially complex, they fall apart. It's safer to practice in the simulated patient setting and increase skill set. So thank you, Hannah. Sorry to add to the end.